Hi there, my name is Quincy. I am one of the certified veterinary technicians and managers here at Healthy Paws Veterinary Clinic. And on this week's episode of our Quincy's Corner videos, we are going to be focusing on spaying and neutering. So, a couple of questions to answer. The first is, why do we spay and neuter? Well, we spay and neuter for a variety of reasons. In both male and female dogs, it can help to decrease or eliminate the risk of certain cancers. It helps to decrease the risk that they are wanting to wander to find a partner, which in return helps keep them in your yard in a safe spot. We don't want them crossing roads or anything like that unattended, because that increases the chance that they could get hit by a car or injured. The primary reason for spaying and neutering, especially if you are not planning on responsibly breeding your pet, is going to be to help eliminate the risk of unwanted pregnancy and unwanted puppies and kittens. So while puppies and kittens are super cute, we want to make sure that we are helping to control the animal population. For both male and female dogs, it can also help to decrease the likelihood that they will become aggressive in the future, along with combining our normal puppy socialization and training and all of those things. So we have to put all of these things together to work in order to make sure that our puppies and kittens are going to be the best behaved pets that they can be. When do we recommend spaying and neutering? So here at Healthy Paws Veterinary Clinic, our doctors recommend spaying and neutering anywhere between 5 and 7 months of age. Important in both male and female dogs to kind of hit that time frame. Especially in female dogs, we want to make sure that they are not going through a first heat cycle. So we want to spay them prior to the risk of them going into that first heat cycle, which can really happen anytime after that 7-8 months age. And some important things to keep in mind as far as recovery goes after the spay and neuter. So we are going to recommend 10 to 14 days of rest, along with having the cone on or the e-collar to prevent them from licking, especially at any point in time where you cannot keep a direct eye on them. Risks of spaying and neutering are mostly related to the aftercare and how active the pet is. So we do have always the risk of undergoing anesthesia and complications from that. However, there are risks where if the pet is not kept calm, if they're overactive, or if they are allowed to lick at the incision site, this can really inhibit healing. We already cringe at the 10 to 14 days of your pet wearing a cone, and by following our post-operative care, which we do discuss more in depth with you at the time of discharge on the day of surgery, following those rules will definitely help to prevent the extension of wearing the cone. So I have seen some cases where it doubles. We're looking at closer to 20 days to a full month of wearing the cone instead of that initial 10 to 14 days. If you feel at any point in time or if you have a concern of how easy it's going to be over that time period to keep your pet calm, please feel free to bring this up to us on the surgery day. We can offer a variety of suggestions on how to keep your pet busy without their bodies being active. We can also help to potentially prescribe medication and help keep them more calm and relaxed over that 10 to 14 day time frame until we can give that green light that they can go back to their normal activities. If you do have further questions on the importance of spaying or neutering your pet, or scheduling surgery, or how our surgery days work here at Healthy Paws Veterinary Clinic, feel free to reach out to the clinic. One of our technicians or doctors would be happy to answer your questions.